Alright, so in this video, we'll be looking at the adrenal or suprarenal glands. The adrenal gland or suprarenal glands. Okay, kindly support the channel by clicking on the like button. Do well to subscribe so that you always get a notification when a content is uploaded. And then make an attempt to share content on the channel, especially to your friends and colleagues who may find the content very relevant. Now, the adrenal glands or the suprarenal glands. We would also look at all the hormones that are produced by the adrenal or suprarenal glands and then their respective functions. Now, the adrenal gland is also called the suprarenal glands. Okay, so another name for adrenal gland is the suprarenal glands. The reason is because these glands are actually located on top of each kidney like a cap. Look at it. Okay, so this is the kidney. Okay, so you see the adrenal gland located on top of the kidney like a cap. Okay, so we have two adrenal glands because you see we have two kidneys. So on top of each of the kidneys, we have the adrenal glands on top. Okay, so they are located on top of each kidney like a cap. Okay, so that is the adrenal gland or suprarenal gland. Okay, good. Now, the adrenal gland is also called the suprarenal gland. It's about 5 centimeters long, 3 centimeters wide, and it weighs 4 grams in adults. Okay, and like I said earlier, this gland is located on top of each kidney like a cap. Okay, now this gland basically has two anatomical regions. The suprarenal glands, they basically have two anatomical regions. They have an outer region which is made up of its layers, and then it has an inner region. Okay, now the outer region or the outer glandular region, we call it the adrenal cortex, and then the second region, which is the inner region, we call it the adrenal medulla. Okay, good. So the gland basically have two anatomical regions. These are the two anatomical regions. The inner region. Okay, and if you take this inner region out, the remaining part forms the outer region. In fact, the outer region is also in 3 layers. Okay, so it has an inner region which is called the adrenal medulla. Yeah, the adrenal medulla. And then it has an outer region made up of 3 layers which is called the adrenal cortex. Okay, so never go and say anywhere that the adrenal gland is made up of 4 anatomical regions. It's 2 anatomical regions, the medulla and then the cortex. Even though the cortex is also made up of 3 sub-zones or 3 sub-layers. Okay, so this gland, adrenal gland or suprarenal gland, has 2 anatomical regions, 2 main regions. The adrenal cortex, which is the outermost layer or the outer layer, okay, and then the adrenal medulla, which is the inner layer or the middle layer. Okay, and then the adrenal cortex has 3 unique zones, 3 main zones or 3 zones. Okay, we have the zona glomerulosa, we have the zona fasciculata, the zona reticularis. Okay, these are the zones. Okay, so the zone next after the medulla is the zona reticularis. Okay, then next to the zona reticularis is the zona fasciculata. Then the last layer, which is the outermost, is the zona glomerulosa. Is that okay? So right after the middle layer of the 2 main regions, which is the adrenal medulla, we have the zona reticularis. Then the middle layer is the zona fasciculata. Then the outermost layer is the zona glomerulosa. Okay, so more like the zona glomerulosa is the outermost layer of the adrenal gland or the suprarenal gland. That's the outermost layer. Even though it's also the outermost layer of the cortex. Is that okay? But it's also the outermost layer of the entire adrenal gland. Anatomically, that is what you should know. Okay, and each of these anatomical zones of the cortex produce unique hormones or produce specific kind of hormones. So for example, the outermost layer, the zona glomerulosa, secretes the mineralocorticoids. The mineralocorticoids is what we also refer to as the aldosterone. And then the middle layer, the zona fasciculata, secretes the glucocorticoids, which we also call the cortisol. And then The layer next to the medulla, adrenal medulla, which is the zona reticularis, secretes the sex steroids, which we also call the dehydroepialdosterone. The dehydroepialdosterone, DHEA. Okay, so anatomically, the adrenal gland or suprarenal gland has two main anatomical regions. The adrenal cortex, these are the anatomical regions. The adrenal cortex, and then the adrenal medulla, and then the adrenal cortex. Even though the cortex too have three sublayers or three subzones. Okay, but the two main anatomical distribution or the regions are just two main. The adrenal cortex and then the adrenal medulla. Okay, then the adrenal cortex is further divided into three layers. The one next to the innermost layer of the adrenal gland is the zona reticularis. So from the adrenal medulla, we are coming to the cortex, but the cortex will meet this layer first, this zone first, the zona reticularis. Then the middle layer is the zona fasciculata. Then the next layer, the outermost, is the zona glomerulosa. So in fact, this is the outermost layer or zone of the adrenal gland or the suprarenal gland, the zona glomerulosa. So the innermost next to the medulla, the zona reticularis secretes the sex steroids, the dehydroepialdosterone. The zona fasciculata secretes the glucocorticoids, example cortisol. And then the zona glomerulosa secretes mineralocorticoids, example the aldosterone. So if you are asked hormones produced by the zona glomerulosa, mineralocorticoids is there, the answer is correct. Aldosterone is there, that one too is correct. It's the same thing. Okay, the zona fasciculata secretes the glucocorticoids or the cortisol. Take note of it, glucocorticoids or the cortisol. And then the zona reticularis secretes. Okay, so you can even be asked that the middle layer of the adrenal cortex secretes hot hormone. The middle layer is the zona fasciculata. It secretes cortisol or glucocorticoids. If you are asked, okay, the innermost layer of the adrenal cortex secretes what kind of hormone? It secretes the sex steroids, the dehydroepialdosterone. Okay, the outermost layer of the adrenal cortex secretes what? It secretes mineralocorticoids or aldosterone. Is that okay? And these are what we refer to as the cortical hormones. Okay, when we say cortical hormones, these are not cortical hormones. These are the cortical layers or cortical zones. So the cortical zones, we have the zona glomerulosa, the zona fasciculata, and then the zona reticularis. But these are the cortical hormones. The mineralocorticoids, the glucocorticoids, and then the sex steroids, or the aldosterone, the cortisol, and then the dehydroepialdosterone. These are the cortical hormones. These are the cortical zones. Okay, so if you are asked to list the cortical hormones, it's aldosterone, cortisol, and dehydroepialdosterone. Is that okay? Is that okay? Good. So we have the aldosterone. Aldosterone, what does it do? Okay, so now we are going to look at the functions. Now you know the cortical hormones. There are three: aldosterone, cortisol, and then dehydroepialdosterone. Okay, now the aldosterone, they work to increase your blood sodium levels. Okay, and then they also work to promote, they increase sodium retention and then potassium excretion. Okay, they increase sodium retention and potassium excretion. Okay, so that means they play a role in electrolyte balance. Cortisol also is a stress hormone. Okay, stress adaptation. It plays a role in glucose metabolism and is also anti-inflammatory. Dehydroepialdosterone is a precursor to sex hormone. It's vital in female androgen supply and libido. Okay, now the middle layer, you see we've not spoken about the middle layer. The middle layer, which is adrenal medulla, it contains chromaffin cells and they secrete the catecholamines. The catecholamines, we have two catecholamines. We have epinephrine and norepinephrine. So if you are asked to mention the medullary hormones, the epinephrine and norepinephrine, or you can say catecholamines, where we have the epinephrine and the norepinephrine. So you realize that the adrenal gland or the suprarenal gland has two main zones, two main regions, the adrenal cortex and then the adrenal medulla. The cortex produces the cortical hormones, which are 3 because of the 3 layers or zones that it has. Each zone produces specific cortical hormone. Okay, so the zona glomerulosa produce the mineralocorticoids or the aldosterone. The zona fasciculata secretes the glucocorticoids or the cortisol. The zona reticularis secretes the sex steroids or the dihydroepialdosterone. Then we have the adrenal medulla. The adrenal medulla secretes or produces the catecholamines. The catecholamines are 2. The epinephrine and the norepinephrine, or adrenaline and noradrenaline. Epinephrine or norepinephrine, or adrenaline and noradrenaline, the same thing. Okay, so if you are asked what are the medullary hormones of the adrenal gland, the medullary hormones, we have epinephrine. Epinephrine works to increase your heart rate, blood glucose, airflow, inhibits digestion, and then insulin to conserve glucose for brain. Is that okay? So basically that is it for the adrenal or suprarenal gland. So this is how the gland actually looks like. Is that okay? This is how the gland looks like. So you see we have the medullary region in the middle. They secrete the catecholamines. Is that okay? Then we have the outermost layer, which is the cortex, which starts with the zona reticularis from the inside. The middle layer is the zona fasciculata, and then the zona glomerulosa. Okay, the zona fasciculata secretes the cortisol or glucocorticoids. The zona glomerulosa secretes the mineralocorticoids or the aldosterone, and then the zona reticularis secretes the dihydroepialdosterone. Okay, so over here you see we have it over here. There's the adrenal gland or the suprarenal gland. We have the middle layer, which is the medulla. Okay, they secrete the epinephrine and norepinephrine. Okay, then we have the zona reticularis. The zona reticularis secretes the androgens. Okay, dihydroepialdosterone and then androstenedione. Okay, and then we have the zona fasciculata, glucocorticoids. The zona fasciculata, glucocorticoids. Okay, they produce the glucocorticoids, example, the cortisol. And then we have the zona glomerulosa. They produce the mineralocorticoids, the zona glomerulosa or aldosterone. And this hormone, this one actually works to increase sodium reabsorption. Okay, and then it also works to increase potassium excretion, like we said earlier. Is that okay? So now let's go to the table. So the adrenal cortex, the outermost layer, how many layers? How many zones? Like we said, 3 zones: zona glomerulosa, zona fasciculata, zona reticularis. The zona glomerulosa secretes the mineralocorticoids, aldosterone. The target organ for this hormone is the kidneys, distal tubules, and collecting ducts. What are they going to do there? They are going to promote potassium excretion, regulate blood pressure and volume, and they are also going to promote potassium excretion. They are going to promote potassium excretion. Is that okay? So they promote potassium excretion, sodium absorption. Okay, and as sodium is being absorbed, water is also going to be what? Water is also going to be absorbed. So they increase sodium reabsorption. Okay, and by so doing, they regulate blood pressure and volume, and they also promote potassium excretion. Okay, then we have cortisol, zona fasciculata. They secrete the glucocorticoids, the cortisol. Their target organ is the liver, the muscles, adipose tissue, and immune cells. How do they do these hormones? What do they do entirely? They promote gluconeogenesis. They facilitate or stimulate fat and protein breakdown, and then they suppress immune and inflammatory responses. Now, the innermost layer, the zona reticularis. Okay, what do? They produce the dihydroepialdosterone. Okay, they also contribute a little estradiol. Okay, and then androstenedione. Okay, this is same as the dihydroepialdosterone. They target the gonads, the skin, the brain, and the muscles. In fact, this hormone is a precursor to testosterone and estrogen. Okay, because we don't have testes. You know, the testes produce the androgens in males, but in females, androgens are also very important in females. Okay, so in females, this hormone plays a massive role in females by letting them get the proportion or the amount of androgens that they need. Okay, so it's a precursor to testosterone and estrogen. Okay, and it also supports libido, muscles, bone growth. Okay, and then we have the androstenedione. It's a weak androgen converted into more potent sex hormones. And then we have the estradiol. It's produced this hormone in small amounts. They target bones, reproductive organs, and they also play a role in maintaining bone density, especially in postmenopausal women. Now, the suprarenal gland. Let's look at the gland again. The innermost layer is the medulla. The outermost, we have the cortex. Okay, so the two main regions. So this diagram is showing the two main regions, the medulla and then the cortex. But this cortex is made up of 3 layers, which we've learned. So the adrenal medulla over here, we have the cortex. The cortex has 3 zones: zona reticularis, zona fasciculata, and then zona glomerulosa. So the adrenal medulla produce the epinephrine and norepinephrine. We call them the stress hormones. And then the zona reticularis produce the androgens, dihydroepialdosterone. Okay, and then we have the zona fasciculata, which produce the corticoids, which regulate glucose metabolism. So they produce the cortisol, cortisone, and cortisone, corticosterone, and then cortisone. Then we have the zona glomerulosa, okay, which is the outermost zone. They produce the mineralocorticoids that regulate mineral balance, minerals like sodium and minerals like potassium. So it promotes sodium retention or sodium reabsorption in the distal convoluted tubules and then the collecting ducts, and also facilitates potassium or promotes potassium excretion, okay, by the kidneys. All right, so now let's look at another diagram, a slide showing the adrenal medulla, the inner or the core of the adrenal gland. So how many hormones are produced there? 2 hormones. Okay, epinephrine or adrenaline, and norepinephrine or noradrenaline, and also dopamine in small amounts. Okay, the target glands for epinephrine: heart, lungs, liver, skeletal muscles. What do they do when they target these organs? Increase heart rate and cardiac output. It dilates blood bronchioles, and then it raises blood glucose via glucogenolysis. Okay, another thing is norepinephrine, blood vessels and heart. What does it do? It promotes vasoconstriction, increase blood pressure. By so doing, it increases blood pressure. It enhances your alertness and focus. Dopamine also acts on blood vessels and brain. It causes vasodilation of renal and mesenteric vessels, and then a neurotransmitter role in the central nervous system. Now, you have to note that adrenal cortex is responsible for steroid hormone production, low actin. And then adrenal medulla is part of sympathetic nervous system and produces catecholamines. That is the epinephrine and norepinephrine. And once it works, it has a neuroendocrine role. You should know its activities will be very fast. And then the hormones from each layer serve different physiological systems or functions. Like, for example, if you go to the zones, the zona glomerulosa, it plays a role in electrolytes balance. If you come to the zona fasciculata, which is the middle zone, the glucocorticoids, they play a role in metabolism and immune response and stress adaptation. And then the zona reticularis plays a role in sexual development and masculinization. So each of the zones play different physiological roles or physiological systems. Is that okay? So basically, that is it for the adrenal gland. So this slide is also showing the adrenal gland. So you see we have the inner layer or the core, and then we have the cortex. Is that okay? Then we have the medulla, we have the zona reticularis, the zona fasciculata, the zona glomerulosa, and then we have the outermost, which is the capsule. In fact, the outermost layer of the adrenal gland is actually the capsule. But if we ask you the outermost layer of the cortex, that is the zona glomerulosa. Pay attention to it. The entire adrenal gland, the outermost is the capsule. But then the outermost layer of the cortex is the zona glomerulosa. Okay, so we have the medulla, adrenal medulla, which is about 20% of the entire adrenal gland. The zona reticularis is about 7%. The zona fasciculata is about 78%. And then the zona glomerulosa. Okay, then the adrenal cortex. So adrenal cortex weighs 80%. Okay, so the entire adrenal gland, the adrenal cortex forms 80%. Then the medulla forms 20%. So if you are looking at the entire weight of the adrenal gland, let's say 100%, the cortex is about 80%, the medulla is about 20%. That tells you that the cortex is very huge as compared to the. Now, if you are looking at the adrenal cortex alone as 100%, the 80%, let's look at it at 100% and distribute it to the zones. Okay, the fasciculata is the largest, about 78%. The glomerulosa is the next, about 15%. And then the zona reticularis is the last, about 7%. Is that okay? About 7%. Okay, good. So the zona reticularis, they secrete the sex hormones, the dihydroepialdosterone. The fasciculata secretes the glucocorticoids, and then the zona glomerulosa secretes the mineralocorticoids or the aldosterone. Is that okay? So this is it. And then the medulla secretes the catecholamines, the epinephrine, norepinephrine, and dopamine. The epinephrine, norepinephrine, and dopamine. So if you are asked a question like which part of the adrenal gland secretes dopamine, that is the medulla region. Okay, the medulla. The medulla secretes the catecholamines. How many catecholamines do we have? We have the epinephrine, norepinephrine, or adrenaline, noradrenaline, and then dopamine, the same name. Is that okay? So basically, that is it for the adrenal gland or the suprarenal gland. Is that okay? Now, as a nurse, it is very important for you to understand the adrenal gland or the suprarenal gland anatomy, because if you understand the anatomy and you know the hormones that the respective hormones that they produce and then their functions, you appreciate conditions like Addison's disease. In Addison's disease, the key point is that it's more like the adrenal gland or the suprarenal gland is underworking. We also call it adrenal insufficiency. Is that okay? Adrenal insufficiency. Okay, so more like a disorder where the adrenal gland do not produce enough of the steroid hormones. The steroid hormones are the cortical hormones, the glucocorticoids. Okay, so it's more like the zona fasciculata of the adrenal gland is not producing its hormones sufficiently. Is that okay? So more like in this condition, there is a damage to the adrenal cortex. Okay, so that adrenal gland, specifically the cortex, is underworking. So in such a situation, this patient is going to experience chronic fatigue. The person is going to be very weak, muscle weakness. The person is going to experience weight loss. The person is going to experience hyperpigmentation of the skin. The person may experience hypotension, because you know the adrenal zone, which we call the cortex, where we have the zona glomerulosa, plays a role in sodium reabsorption and then potassium excretion. Once sodium is being reabsorbed, water follows, and that can help to maintain your blood pressure. If that is not done in your body, you can end up losing a lot of your blood volume and you'd be at risk of hypotension. Okay, so a patient with adrenal insufficiency, like Addison's disease, would experience hypotension. And because these patients may also be lacking salt, because once you have a problem with adrenal cortex, you would lack salt. And usually these patients experience a symptom that we call salt craving. Salt craving. The patient will experience depression, hypoglycemia, hyperkalemia, because see, this hormone, okay, the adrenal cortex, specifically the zona glomerulosa, it produces the mineralocorticoids or the aldosterone. Aldosterone promotes sodium reabsorption or retention, whilst promoting potassium excretion. So if you have less activity of the adrenal cortex where the zona glomerulosa is not working properly, there is going to be what we call sodium retention will reduce, and then potassium excretion would also decrease. So you are going to retain a lot of potassium, okay, whilst also excreting more sodium. Okay, so the patient may end up having hyperkalemia. Is that okay? Hyperkalemia, and then hyponatremia. That is what happens in Addison's disease. Is that okay? Then we can also have a condition called Cushing syndrome. Cushing syndrome is like the opposite of Addison's disease. In Cushing syndrome, we have what we call, it's more like adrenal hypersufficiency. Is that okay? So it's like there are high levels of cortisol in Cushing syndrome. In Addison's disease, there are low levels, adrenal insufficiency. In Cushing syndrome, there are high levels of the cortisol hormones being produced. Usually, these patients will experience central obesity, unusual hair growth, hyperglycemia. Okay, the patient may experience gonadal dysfunctions, osteoporosis. Okay, the patient may experience some of these signs. And as a nurse, your understanding of the adrenal gland anatomy would help you to appreciate even some possible tests that should be done for these patients. You appreciate why a 24-hour urinary cortisol level should be assessed. Is that okay? Good. And then you would understand why you may have to pay attention to electrolyte levels like potassium, like sodium. You get it? You have to pay attention because you know that once there is adrenal hypersufficiency in Cushing syndrome and cortisol hormones are being produced in excess, you understand that, okay, then of course there is a hyperactivity of the adrenal cortex. Then of course sodium levels are going to increase. There is going to be hypernatremia, and then there is going to be hypokalemia in Cushing syndrome. But then when you go to Addison's disease, there is going to be hyponatremia and then hyperkalemia. Is that okay? And you appreciate why you have to pay attention to these electrolyte levels in the body. So basically, these are the significance of the understanding the adrenal gland anatomy. Okay, there's the significance of understanding the adrenal gland anatomy. So in summary, the adrenal gland has two main anatomical zones: the cortex, adrenal cortex, and then the adrenal medulla. The adrenal cortex also in zones. Okay, also in three zones. We have the zona glomerulosa, the zona fasciculata, and then the zona reticularis. The zona glomerulosa secretes the mineralocorticoids or aldosterone. The zona fasciculata secretes glucocorticoids or cortisol. And then the zona reticularis secretes the steroid, dihydroepialdosterone. Then the adrenal medulla produces the catecholamines. Okay, the catecholamines are three: the epinephrine, norepinephrine, and dopamine. Or epinephrine or adrenaline, norepinephrine or noradrenaline, and then dopamine. Is that okay? Good. So this brings us to the end of the adrenal gland or the suprarenal gland. Okay, thank you so much for making time to watch this video. Okay, see you in our next video. Kindly click on the like button, subscribe to the channel, and do well to share the content to your friends or your colleagues. All the best.